AIIMS New Delhi Professor of Neurosurgery, Dr. Deepak Agrawal. Hello sir, can you please tell us sir, what is headache?
Any pain in the head or neck, including behind the eyes or inside the ears, is a kind of a headache.
Why do headache happen?
Due to changes in chemical milieu inside the brain, or changes in the vessels inside the brain, or because of genetic factors or other reasons which we don't know of, headaches can occur in every person.
Sir, what are the causes of headache?
I think every human being has at one time or other had headaches. It's a very common thing, and there are so many causes. The most common is obviously stress or tension headaches because of whatever is going on in our lives. The second most common is migraine, which is also seen especially in women. Third, we have the classical headaches, which can be seen in the general population. And fourth, we have headaches secondary to causes such as raised intracranial pressure or because of any infection.
Where are stress headaches located?
Stress headaches are usually located in the frontal region in the front or behind the eyes, and they can also be present at the neck, and because these are all because of stiffening of the muscles supplying these regions because of stress.
Please tell us sir, what is migraine?
Migraine is a special kind of headache which, as I said, usually affects females, and there is a family history in this type of headache because it is thought to be genetic in nature, and brain vessels dilate under certain conditions leading to this kind of headache. What is classically seen is this affects half the head, so there is a hemicranial headache with symptoms of impending headache just before the actual headache starts. So you have feeling of nausea, vomiting, you want to rest, and this headache usually lasts for days or even weeks in certain cases.
What is a spinal headache?
Spinal headache is one in which after a lumbar puncture or after a lumbar injection with like an epidural or an anesthetist, a patient gets severe headache which is lasting days or weeks, and this is due to CSF leak from the spinal canal and also known as low pressure headache.
And what is hypertension headache?
Hypertensive headache, as the name suggests, is because of raised blood pressure and commonly seen in patients with uncontrolled blood pressure. It is also seen in patients who have blood pressure but are taking medicines because of intermittent spikes or because of irregular medications.
Can headache damage our eyes?
Yes, headache can definitely damage your eyes. So if it is because of number one, raised intracranial pressure, or number two, there is something else going inside the brain like an infection which may be affecting the nerves of the eyes also.
And how do we know if our headache is serious?
Any headache which is so severe that it is on a scale of 10 out of 10 and has never occurred before in your life, then it is definitely pointed towards something going on inside your brain. Could be a rupture of an aneurysm or a kind of a stroke. Also, any headache because of any tumors or infection is also serious, and you should definitely see a doctor in all these conditions.
Sir, can headaches be fatal?
Headaches can be fatal, as I said. Any stroke, bleed, aneurysm rupture, all these can be fatal. Also, tumors, if not treated in time, may be fatal for patients.
Sir, how do naturally stop a headache?
There are various ways to naturally treat headaches. One is to keep fit, meditate, de-stress, detoxify, and these will definitely help in the majority of the headaches. Migraines can be helped by taking a lot of caffeine, so taking coffee or tea can help you in migraines. Also, doing regular exercise, taking healthy food. There are certain foods which precipitate headaches, such as cheese or chocolate, and if you know what foods are precipitating your headache, you can definitely avoid them to lead a headache-free, healthier life.